While the Supreme Court ruling is now finally known, a lot of other things about the Affordable Care Act are unknown. For one, will states be able to set up the insurance exchanges required by the law in time for a January 2014 deadline?
Without a doubt, there's a significant amount to do between now and January 1.
10 states in the District of Columbia have already played along. Oregon voted in 2009, a year before the health overhaul was approved, to create an online state health insurance exchange. Other states haven't. Wisconsin will not take any action to implement Obamacare, Wisconsin Governor Scott Walker wrote in a statement. He's banking on Republicans winning big in November and repealing the law. Texas Governor Rick Perry called the court's ruling a stomach punch to the American economy. And in Florida
stands at the bottom of the list. Unfortunately, the legislative leaders and the governor and the attorney general have showed no interest whatsoever in ramping up to meet the obligations for the Affordable Care Act.
Politics aside, many states chose to wait for the Supreme Court ruling. Why set to work if it may be for naught? But now they'll have to play catch-up or risk the federal government coming in to run the exchange for them.
I don't think the states right now have any idea exactly how much time it's going to take to scrutinize and approve all of these new policies. They've never had to do that before.
Another issue for states, the law's Medicaid expansion. It'll create an influx of previously uninsured patients to hospitals and doctors, and a lot more paperwork for an already burdened system.
What we really need is for these uninsured people to hook up with primary care physicians and get good medical care.
But there is still a question of coverage for the newly eligible Medicaid patients in states that opt out of the expansion after the court ruled they can.
If states choose not to participate in the expansion, then yes, there will be populations in those states that will no longer be gaining coverage under Medicaid that would have had it in the event that the Medicaid expansion was mandated on states.
More than a dozen states are considering not participating. Noel Waghorn, The Associated Press.